Hello, good morning, Sitaram, and welcome to another program in the series, Addiction and Recovery. I'm your host, Ram Naresh Dwarika, again, reminding you that this program is being recorded and will be posted on YouTube and Facebook at its completion this morning, and it will be repeated again on radio and TV Jagriti at 10 p.m. tonight. So those of you who are unable to stay for its entirety this morning, you can come back and listen to it, or you can go online on the various platforms and listen to it there. And it is also a very useful resource that you may be able to send a link to someone who you believe can benefit from this program. Let me apologize for starting a little bit late this morning. We had some technical difficulties, but we have sorted them out. This morning, we are having a very interesting program. I've put together a condensation of a lot of what I have discussed on these programs in the past. And today we are going to look at why addiction happens. Why? Why? Understanding what sets the stage and the deeper reasons why people are predisposed some people are predisposed to addiction and some people are not. Some people may drink and, for their whole lives and continue to have some level of control. And as we say, they become social drinkers, and why some people go on to become addicted. And then we want to look at not only the predisposing factors, what would have led to it, but what actually triggered it, the precipitating factors, because it is different for everyone, and hopefully we before the end of the program we could look at some of the perpetuating factors. That is, the factors that cause a person not only to start but to continue to use. So at the end of this, hopefully you, our brothers and sisters listening, will have a clear idea of what are some of the factors that could lead a person to drug addiction, and what are some of the things that can trigger it, can cause them to start or go from social drinking into compulsive drinking, and what it is very important to understand why, in spite of all that is happening with them and around them, they can't seem to be able to stop the perpetuating factors. So we will look at that. And first, let's look at what are some of the predisposing factors of alcoholism and drug addiction. And the first one is a family history. And why? Because children, they learn what they experience, what they live, what they see. Stop for a minute and think, every one of you listening to this program this morning, how much of what you do you have learned from your family and your friends and your ancestors. And not only that, there's an African saying that it takes a community to raise a child, but we also learn from our community, our neighborhood, our friends, our peers, the society, the culture. And when we think about culture, when we think about Trinidad and Tobago, drinking is so deeply interwoven in the social fabric, to the extent where we we can't seem to have any occasion of celebration without alcohol or drinking and that sort of thing. So that, coming back to, if there's a family history of alcoholism and drug addiction, we also know that there are genetic factors. Science has been able to isolate the genes, actually, that could predispose a person to alcoholism. The research has borne this out, where if your father or your mother were alcoholic, there's a 60 to 80% chance that you could become an alcoholic. Now, this is not to say all the children will become alcoholic. Some, just like we have slight resemblance of others and so on, we all don't have the exact same genetic makeup. Some may not become alcoholics, but there's a higher risk of alcoholism and drug addiction in families where there's a history of drug use. So that because this is not only a genetically inherited um, illness, it is also a socially learned behavior, as we will discuss in this program this morning. Some people would have started out of curiosity, because the culture suggests, the Christmas party coming up and office parties or some wedding or birthday. And I have seen birthday celebrations for 1 year old, but the amount of alcohol and drink and so on is presented on those occasions. You wonder because the baby doesn't even know what these things are, but the occasion is used as an excuse for adults to really engage and indulge themselves in alcohol and drug use. So that there are some families where there's a high incidence of alcoholism, and the culture in the family is to drink. And I grew up in one such family where there's a lot and in the community in which I live as well. It was a agricultural community where people worked in the estates, and I would see every day the men who coming from work, especially in the crop time, they will not go home. They were still in all the black clothes from the cane ashes and all of that, and they will be in the bar drinking and getting drunk. So that there's a family history. Children copy what they see, what they experience, what they learn, what they are seeing. They're seeing when family come. In fact, they used to send me, and I've seen it happen in other households, just send you the little one, go to the shop, carry a handbag and buy the flask of rum and ask for a tray of ice and that sort of thing. And so what we see, we'd sit down and look and see, they were entertaining with alcohol. Not only entertaining, if there was a wake, there would be alcohol, they would be passing the drink. If there's a birthday celebration, there's the drink. If there's a wedding, of course, it was seen as a rites of passage. I would hear the groom's friends saying, "Hey, you're a big man now. You could take a drink." And a lot of grooms have gotten so drunk that they can't even remember the first night of the wedding. So then there are some people with a kind of brain chemistry, who are more sensitive to rewards. What alcohol does, there's a substance in the brain called dopamine, and the alcohol and the drugs, the marijuana and the cocaine and all of that, causes the brain to release the dopamine. Dopamine is what makes us feel happy. So if you went to church, you went to temple, you sang and clapped and listened to music and felt happy, it is because your brain released a little dopamine. You win the cricket match or whatever, you pass the exams, you feel happy, the brain released a little dopamine, make you feel happy. But this takes a little while, and takes an event. But alcohol and the other drugs, the marijuana and the cocaine, cause your brain to release the dopamine almost immediately. Instantly, you transform from being sad and morose and all of that to being happy. And people remember that. The shy guy, I remember being part of a band. We went to sing in La Romaine, and I was getting the butterflies when my turn was coming up to go and sing with the band. One of the older guys took me aside and gave me a strong drink. And I went up there and I was only supposed to sing one song. I sang two, I was getting ready to sing three. And I remember that for the rest of my life up to now. I never felt so brave. And it is also sometimes referred to as a social lubricant, where a lot of people, I know guys who would be afraid to ask a girl to dance, but had to take a few drinks to build up the courage. I did that too. And we remember those experiences. So that some people are more predisposed to this than others. And there have been a lot of studies that shows that, where there's what you call the twin studies. Those of you who are minded, you can research it. where even though one was not drinking and the other drinking, the addiction went across the board. Um, then there are psychological factors that predisposed a person. I have spoken on a previous program about early childhood trauma. You know, child growing up in a very pathological family setting, a lot of stress, abuse, and all of that can develop what is called maladaptive coping skills. And later, when they are introduced to alcohol, you find that they are more susceptible, they're more tend to. So that these are all they're biological predisposing factors, they are psychological predisposing factors, and early childhood trauma is one of them. Then there are mental health issues where there are people who naturally suffer with depression and anxiety, or in more recent time, a lot of children are being diagnosed with attention deficit hyperactivity disorder, ADHD, and they are being prescribed psychotropic drugs to help to manage those conditions. What I am seeing in my practice, a lot of people who went to the psychiatrist because of anxiety or depression, you know, because they were jilted in a relationship, or they failed their exam and became depressed, or started becoming anxious when they had to write exams, or because of the pressure that they felt to pass, or the fear of failure that led to the anxiety. And they would, and then there are those who are naturally, you know, suffer with attention deficit, they are hyperactive and all of that. And our first intervention method is to go see the doctor, go to the psychiatrist. And 99% of the time, they're prescribed some uh, psychotropic drug to help them to manage the symptoms. And these drugs are very highly addictive, to the extent where a lot of people, once you start using it, you become dependent. And then what happens? The body develops tolerance. So the 2 milligram or the 5 milligram, after a while, will not work. You have to start taking more, and then you start taking more often. And then a lot of people who are introduced to alcohol, especially upper and middle class families where there's a bar in the house and it is the culture to take the nightcap and all of that, the children are seeing this and they go help themselves too. And they are encouraged when they have their own parties and so on to invite their friends, and they have a real bang, you know, on those occasions because they can afford it. It is there, and they're seeing the parents do that. So example is the best teacher, and they see, well, the friends, the family, the parents, and so on do a lot of entertaining and so on at that level, and most of the time the entertainment is intermixed with drinking and sometimes drug use as well. And the children, they are seeing this, they're learning this, and they're also starting to use it. And so that I am seeing a lot of young people now, university level students and so on, upper and middle class children who started off on psychotropic drugs prescribed by the psychiatrist, who are also now using alcohol in conjunction with those. And that is a dangerous practice, because the people who formulated the drugs did not do the test in conjunction with alcohol. So that a person taking, for instance, sleeping pills and taking alcohol, which is also a sedative, can not only put their brain to sleep, but it can put their heart to sleep as well. And if your heart drop asleep, you know what is the consequence. So that a lot of mental health issues also predispose people to later on start using alcohol to supplement the drug, and then find that they can't get off. Because with the psychotropic drugs, you don't have some of the social consequences. You don't get drunk and fall down and all of that. But then when you start using the alcohol with it, then it interferes with your behavior. People are getting very, very inebriated and getting into accidents, falling down, damaging themselves, misbehaving and behaving violent and all of that. That's another story. And then there are personality traits, you know, where some people they are impulsive, they like to take risks, they like to outshine everybody else, and they always believe it will happen to everybody, but not them. And I could relate to some of that. I remember in the early days, me and my friends, I would have been 14, 15, and we go to the to the river to bathe, and some one of them stole a cigarette from the father pack and light it. And I, of course, wanted to show I am not less than them. Because while some of them would take their first pull and start coughing, I would pull on the cigarette and I will not cough. And I felt, I, I was better off than them. I could, I had bragging rights. So a lot of people are impulsive and they're daring, and that too could also lead to it. Then those are psychological factors. Then there are social, environmental factors. And of course, I really refer to some of them earlier on. Growing up in a household where drug use is common, I mean that is expected. And I know not only common, but in a lot of households, family members, I remember myself, you know, being given a drink of cherry brandy at Christmas. I would have been just about 6 or 7 years old. And it was not because my 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 grandparents did not like me, or they were my grandmother was alcoholic. No, no, no. They just thought, well, it's Christmas. And for them it was fun. Yeah, give him some cherry brandy. And I never forgot that. So growing up in households or in communities where there's a high incidence of drinking and drug use also sets the stage, makes it much more easier. And then peer pressure, of course. We hear about peer pressure all the time in a dollar sense. And like I said with the cigarette, so too I remember going with some friends. We were walking from Gandhi Village, where I grew up, to the creek, which is Mosquito Creek, to bathe in the sea. And on the way, we were going to the company road, and somebody had a brown paper bag with a bottle in there. And two or three of my friends took a swig from it, a drink, and then they passed the bottle to me. And I tell you, I didn't even bother to look inside it what it was. If my friends they could drink, I suspected it was alcohol. And I had a drink, boy, and that thing blistered my throat. But I smiled and I passed it to the other guy. That is what peer pressure is about. Wanting to be part of the group, wanting to show I'm not less than. You understand? And we do that in not only with drinking, we do that in school. We want to be better. We want to come out first. We want to pass everybody else. We do that in sports. We want to outshine everyone else. We want to win the race. And we are encouraged by our society and our communities and our parents to do that. So why not in alcohol? You know, we have to prove ourselves. So peer pressure and poverty or lack of education and unemployment. Now, poverty in itself is not a reason why people use drugs, but it contributes in a way in that a lot of people, poor people, they use alcohol to help them to cope with their life situation, and it becomes the culture. It becomes the common practice in the household. So that yes, in that way, poverty can influence drug use, and of course, lack of education. Now, I say that because I have found that my patients who are educated, who have reached secondary and tertiary level, they're more motivated. They seem to have greater insight into, and you can reason with them. You can appeal to their judgment in planning a program for recovery. The less educated, this is not that I've seen a lot of less educated, not academically educated, but that does not mean to say people are not wise. You have uneducated people who are very wise. And I've seen a lot of them go to AA and so on, and they are staying sober. But unemployment, and the fact is, unemployment translates into a lot of free time, and the old saying, idle hands or idle brain is the devil's workshop. And so a lot of people, to cope with unemployment and to pass the time, engage in marijuana smoking. They go on the block and they smoke and drink and that kind of thing. So now, what may trigger it? What might precipitate it? All of these other things set the stage, but what actually triggers it? A person might be poor, they might have grown up in an abusive environment and all of that. They had relatives and so on who are alcoholics, drug addicts, so they have the genetic predisposition. But you find that these are the people who, you know, are easily triggered. And what are some of these triggers? Just a few of them is like, for instance, the loss of a loved one, you know, divorce, loss of a job. A person who might have been using it with some level of control, then with these crises happening in their life, it seems to trigger, and it's almost expected and socially acceptable in our society, where a person who has tabanka, who has lost his wife has left him, he seems to have a ready-made excuse to drink, and people understand, he's sad. So he's just using it to cope and hoping that, in a little while he will adjust and that will stop. But that could take a person down a spiral, because while you are nursing your psychological trauma, you're trying to cope, your body is becoming habituated to the alcohol and the drugs. So that eventually when you're now trying to stop, you are going through what is called withdrawal. And we will talk about that in the perpetuating. That is one of the perpetuating factors that cause a person, even though they have insight and know they need to stop, but they can't seem to do it because now the body, if they don't drink, they can't sleep, they can't eat, their hand is shaking, they can't sign the register, and some of them start hallucinating if they don't have drink. They go into what is called DTs and so on. So again, what are some of those things that trigger it, actually precipitate it? And the loss of a loved one, divorce, you know, a loss of a job, and we're seeing a lot of that happening these days. And then there are other factors like academic failure or bullying in youth. There's so much pressure now on young people to achieve. I know parents are taking children from school to lessons, weekends lessons, for holidays camp, and music class and Tai Chi class and you name it, dance classes, and the children are not really getting a reprieve, you know, whether they like it or not, because a lot of parents are using the children to sublimate what they could not have done or achieved in their lifetime or were deprived because of whatever circumstances. They are trying to sublimate through their children. That is, achieve it through their children to gain that gratification, even though the children may show no inclination for that sort of activity. There are children who might be more better at skills, not so academic. But academia is the way. All children have to fit in that what they call cookie cutter in sociology, whether you like it or not. So that when they fail, it is shattering. And some of them who would have been introduced to the drink or drug or prescription pill tend to go overboard with the pill or with the drug, because now the anxiety level has gone up. And then there are children who are being bullied in the school as well, who are and are afraid to speak about it, find that they can't escape it. You have to go to school, whether you like it or not. And in the school, you have all of these other boys and other girls who are waiting there to taunt you. So can you put yourself in the position of a child who's experiencing that? And then there is, of course, the whole question of peer group, peer and social influence, where friends who offer drugs at parties and so on. There's the whole saying, show me your friends and I'll tell you who you are. Well, I mean, I did not get a cigarette at home to smoke or drink at home, but I had friends who had access to it. And I looked forward to going and meeting them. And it was exciting and adventurous to go down by the river, and smoke and take a drink and all of those things, you know. And this is why, as I reflect on that, even though I grew up in a very strict home with very good influences from my ancestors and so on, respectable people. But in my community, I had friends who didn't have the same kind of privilege, whose parents were alcoholics and that sort of thing. Yeah, well, even in my home, my grandfather drank heavily as well. So there is again friends who offer, even though you might be trying to grow up your children to the best of your ability, but as I said, it takes a community to grow a child. So your children are exposed to this. In the schools now, I when I used to be president of the National Council on Alcoholism, we would be invited very often to schools to speak to the sixth formers and the younger ones sometimes too, who were bringing alcohol in the school in sweet drink bottles and getting drunk behind the school and all of that. So that, and then in Trinidad, as I referred to earlier on, there's a cultural acceptance of alcohol and even marijuana now when the government go and decriminalize it and give the impression that, look, it's okay to smoke marijuana. And most important is availability and access. Easy access to prescription pills or street drugs is one of the main reasons that people use drugs. There's a saying, if you don't have a flute, you can't play a tune. Well, so too with drugs. If you don't have it available, you can't use it. But the abstinence movement in the States, they tried that in the Middle Eastern Muslim countries, they try that. And what happens? People will find ways to get around the system. There were what you call these speakeasies in the United States where people would turn their downstairs, how you call it, the basement into a bar, and there were these secret bars that would be raided, and then of course you had the whole question of now Al Capone and all of them getting into the business of ferrying drugs from one state to the other and so on, and a whole mafia business started as a result. So that what are some of the perpetuating factors? One is there are biological perpetuating factors where the person now who started to use it to help them to cope, the prescription pill or the alcohol and so on, or the combination of it, and then eventually starts developing tolerance. The body is like this. If 2 milligram will pass your headache, after a little while, if the headache persists, 2 milligram will not work. You'll have to start taking 4 or 5, and so on and so on, and so too with alcohol. Those of you who have been drinking or had the experience, you would remember the first time you took a beer, you felt the buzz. But after a little while, one beer that did nothing, you had to drink 2 and 3. And that's my personal experience as well, to the extent where I could take a whole set of fellows, get them drunk, drop them home, and go back again. You develop tolerance where you need more and you need more often. So that again, that has implications for diagnosis because how much a person drink, how often they drink, does not determine whether they're alcoholic, or drug addict. Because as you develop tolerance, you'll be using more and more and more and more. But the person who would have just started is also alcoholic. So that what happens, a person who has become dependent on the drug, when they stop, they go into what is called withdrawal. Withdrawal symptoms will include anxiety, depression, the same thing for which you were using the drug. When you don't use it, it becomes worse. And this is why you become dependent on it. And some people can't get off these psychiatric drugs for the rest of their life. Because if they did, they'll start hallucinating and go crazy. However, as I say this, I want to let you know that there is hope. I've been using acupuncture to help a lot of people come off these drugs, successfully. So coming back, the pain of withdrawal is what prevents a lot of people from even thinking about stopping, because they know the few times they ran out of the drug and they didn't have, and they went through withdrawal, which was the shakes and the vomiting and the nausea and the palpitations and the pain and the hallucinations and all of that. It's very scary. People who have not used drugs cannot even imagine this. So as a result of that, they don't even think about stopping. When you tell them just they should stop, they don't hear that. They hear you telling them to stop living altogether. They can't understand or imagine how it will be to live without drugs. So drugs become a coping mechanism, and when they don't use it, they feel guilty, they feel shameful, they feel hopeless, and that those feelings of guilt and remorse, because after you mash up the furniture last night, or you hit the car, or you went and gambled the money, now how are you dealing with that? The guilt and shame produces so much stress. The only thing you know how to deal with it is to go and take a drink or a smoke. And that, of course, fuel further use. Now, yes, there are social barriers that try to mitigate these things, to prevent them, like the stigma. But then that turns around and becomes even the worst thing, because of the stigma associated with it. A lot of people don't want to admit they have a problem, and they don't want to seek help either. Although the stigma should prevent them from doing it and becoming alcoholic. But now that they have become alcoholic because of the same stigma, they don't want to go and seek help. And they keep going back, to the same group. Once there are people who, even though they realize, look, I have a problem, I need to stop. But they belong to a group now, a peer group, where when you're not drinking, your friends come in looking for you and carrying you to drink. And you can't say no because you lose all your friends. You understand? At the height of drinking, all my friends were drinkers. And the only activities I would engage in is activities that had to do with drink. It was a wake, then I'll go, or a wedding, or a birthday party, or a river line. And I'm going to PTA meetings and prayer meetings and that kind of thing again. You understand? So that, in summarizing, I want to say that, there is the background risk, there is precipitating triggers and perpetuating factors that maintain the cycle, but I want to let you know that addiction is not just about bad choices, but a complex interplay of biology, psychology, and the environment. But in spite of all of this, I want to let you know, those of you listening there, that recovery is possible with support, with treatment, and with community understanding. And I must say, in Trinidad, we are fortunate that we have treatment facilities. At Cora Hospital, there's the Substance Abuse Prevention and Treatment Center. We have about over 100 active AA groups in Trinidad and Tobago now. It used to be 124 before the COVID. I know a few groups have dwindled, but now we have an added resource in that we have online AA meetings that are not only in Trinidad and Tobago, but international. So there are meetings going on around the clock, and you don't have to even move a foot to go to these meetings. You can stay right where you are on the couch, your bed, your office, your chair, your hammock, and you can, with your smartphone, access any of these meetings at any time of day. So that help is available. And although addiction is powerful, I want to say that recovery is stronger. You know, I just celebrated 41 years and 11 months and a few days of sobriety. My last drink was on the 10th of December 1983. And I can tell you it is the best decision I ever made in my life, because after I stopped drinking, I went back to school, went back to university. And that's why I'm doing what I'm doing today. In my drinking days, I could not even imagine that someday I'll be speaking to you all and talking about the recovery from alcoholism and drug addiction. So that I want to let you know that any of you, if you know someone or if you yourself think you may have a problem with alcohol or drugs, you are becoming addicted, it is always just like any other illness. It is always better to pick it up early. If you attend to it early, you can prevent yourself of 10 to 15 years of literal hell and misery. And not only yourself, but for your family and your children and your community, even for your workplace. So if you think you might have a problem, or you know someone close to you, a sibling, a relative, a friend, you can let them know that help is available. You can send them a link from this program to let them know that, look, you understand it is not a bad habit. It may have started out of curiosity, may have started off as recreational drinking, but sorry about that. Yeah. However, it is a disease recognized by the World Health Authority, and the help is available. So I want to thank all of you who have been listening to the program. And if you have questions, of course, you could post it on YouTube or Facebook, or you can call me at 671-3040, and I'd be happy to respond to them. I want to thank the radio and television station, although we started a little bit late, but we did cover quite a bit in this program. And I want to thank them for giving up the airtime free of charge as a community service to our brothers and sisters worldwide. So I want to thank you, all of you, for listening. And until next week, Thursday, where we meet again, good morning and Sitaram.